Newzroom Afrika's Ziniko Mhlaba is in Rosettenville in Joburg, where foreign nationals are allegedly being denied healthcare at a clinic. He joins us live for more. Ziniko, good afternoon to you. What do we know about what's actually been happening there?
Good afternoon, Stephen. Well, I just got some information from the people who have been here at the Rosettenville clinic south of Johannesburg, just to get a sense of what exactly has been happening as far as these allegations coming out, stating that there are some groups on the ground that are denying people who are non-South Africans with or without document access to the local healthcare facility, and indeed they did confirm that actually that is the case. It is happening on the ground, but usually from the early morning up until midday, when there are high volumes of people who are coming out to the clinic, but also stating that they are saying that, well, people need to produce identity document for them to be allowed inside the health facility. So currently the facility is clear because there are no patients at the clinic, but I did manage to pick up some people who were walking away from the clinic. They had stated that they are being denied. I'm not sure if you can still see them. Actually, those are the two women. The one in brown jacket, she told us when she was still outside the clinic that she had been denied access to the clinic. I'm not sure if you can just try to get closer to them, but also there is an EFF activist who has been providing that support for them, negotiating for the healthcare facility to be opened for these individuals. So we're just going to drop in an ear here as we try to speak to Umama about this particular problem. So you've got two sides here. You've got the community organizations that are against foreigners in terms of them accessing the health facility. Then you've got the other activists who are saying that anyone has a right to basic healthcare services. And this is a conversation that is going on. I'm going to drop in an ear here. Mama, ask his mama, ask his mama, ask his mama, man. We've got this problem that has been happening here.
Yes.
Talk to us about and how was the situation as you found it in the morning.
Okay. Okay. Greetings. I'm Raisibe Chauke from Rosettenville, Ward 56, under the leadership of EFF. We've been in Rosettenville since on Monday. There's a group of communities who were denying the foreign national access to go and collect their medication. So this morning, we managed to invite the ENCA News to come and assist.
This is Newzroom, ma'am. Today Newzroom.
Oh, okay. Yes. Okay, sorry. Since we've been there, they didn't get access to go and collect their medication. As we speak right now, they don't even have nothing.
Okay. Singakhona ngitshintshontshe ukuze bazi ukuthi bakhuluma ngani bona mhlawumbe. Ngicela usibuzele ukuthi inkinga yabo injani, bafike bathini eclinic xa befika pha. Okanye ithini basondeze mama nendive kubo. Ungahambi imapha ecani kwabo. Uzobakwazi utolukela. Mama, talk to us about where you coming from and what happened when you went to the clinic.
In the clinic, Rosettenville clinic, I come from yesterday, never enter. He tell us, I said, this is not a foreigners clinic, only South Africa clinic. And to do so, I come, never give me. So now, I don't know.
Where are you coming? Where is home, Mama? And what did you want to get from the clinic? Why did you go to the, what kind of services did you need from the clinic?
In the clinic, I come, I'm from Zambia. I come to collect my medication. Now I come to collect my medication, never give me. I say only medication for South Africa, not foreigners. Yeah.
How have you been coping with that medication now? How has it affected you and your health?
Because I'm not feeling well in my body. I'm not feeling well. That's why I come to clinic to take my medication. Okay. Now, clinic is not allowed to give foreigners. I say foreigners go to your country to take a medication. As my country is not here. Okay. And normally to go home for this time, I say I go to take a medication there. That's why I come here to Rosettenville to take my medication. Never give me.
Okay, yeah. Just hold on for Mama. Mama, talk to us about, okay, Mama is not comfortable talking. Mama, just the situation that you are explaining here, how long have you been attending the clinic? How long have you been taking the the medication. Don't tell us what you're taking the medication for, but how long have you been using the clinic to get help?
It's many years. Many years I'm here to take a medication, so I don't know for this time. Yeah.
Okay, Mama. So, Stephen, the lady is coming all the way from Zambia saying that she has been denied access to the clinic. She's saying that she's not feeling well. Okay, so she's been taking the medication since 2010 at the very same clinic, but this morning she was told that the medication is only for the locals, for South Africans. So she is on her way home with her friend without getting that medication, and she's saying that she's not feeling well at all. But to continue with this conversation, Mama, Stephen, I've got someone from who's the ward committee member, so and the clinic member as well. So she will be speaking as ward committee member, which is a structure of the community, but more under the Council of Johannesburg, just to give us a comprehensive report in terms of what happened this morning and what do they have to say now. Because they have this community divided on two sides. There are those that are saying we don't want community foreign nationals to get access. Then you've got other organizations that are saying that everyone has a right. How do you deal with this, Mama? But before you answer that question, can you tell us what happened in the morning? What has been your experience?
Okay, good afternoon to all of you viewers. My name is Rosettenville Afrika. As he has already alluded that I'm the ward committee member here and also the clinic member. This morning when I arrived here, I noticed that group of people who usually call themselves March and March, and they are against to any foreign national that must have any access here. So the problem is, this is not coming from the Rosettenville clinic. We would never allow it here in this ward, under our nose, from the council. Everyone constitutional that you know, has a right to medication in this country. But however, we have engaged EFF and also those ones who call themselves March and March, that we should find each other. And as a result, we'll be having a meeting on Monday. And with what Mama has just mentioned, the Lento patient, I know this lady here from Rosettenville. She has been here for quite some time. And I was even here yesterday when they were told that they should come today, precisely because there was no water, the whole Rosettenville, I mean the whole area in the south, from the 30th up to yesterday. And it was mentioned that the water would be restored. That was when they were turned away. But they were never turned away by the clinic, telling them that you are foreigners. Okay. You will not be attended. They were told that each and every professional nurse has to rinse her or his hands. Okay. Yes, frequently. Okay.
Yes. So how about the conversations between March and March, EFF, going in terms of trying to make them understand that according to the country's constitution, yes, they need to access that? How has been that going in terms of engagements from your side?
We have had quite a long discussion even before you people as the media came, you know. We were trying to make sense to them. But let me be honest with you, there was never any commotion like it happened last year or year before last, when there was a big commotion and then people were injured. Okay. It never happened today. Okay. Through our efforts, because even the EFF was not arrogant to them, even them, they were not arrogant to each other. Okay. And we're monitoring that. That is why we have reached to the point that let's have a meeting and engage political parties and NGOs, all stakeholders, so that we find each other. And way forward, we will definitely be able to find a solution that even those people who are not even legal here in the little country, probably they cannot be let there just to let die.
Mama, as someone who works in the clinic, you can't speak on behalf of the clinic. No, that I understand, yes. But in terms of the people that you assist, the people that you know from your community who access services from the clinic, in terms of numbers, what are we looking at? Because the allegation made by the March and March people, they're saying that most of the people who get into the facility or who need health facilities are not South Africans. What is the ratio and how does that impact the operations of the clinic? Without maybe giving us specific statistics you might not have.
Okay. I'm not talking on behalf of the clinic, but what I have observed is that it's about 70 to 80% of foreigners that are coming here. And if you look at the numbers on a daily, it's far more than 100 that the nurses they have to go through, examining patients, you see. And then it was raised in our meeting. I actually raised it in our meeting with the boss from the Region F, that how would you expect these people, to be working, to be overworked, let me say that, yeah. One nurse maybe, I'm just assuming to what I have just seen, one professional nurse has to see maybe more than 60 patients a day, which is not on, you see. I'm not a professional nurse. I'm just talking to you as an observer. And then on the other hand, what they have also mentioned is that the identity theft, that some of them, they do come here sharing an identity, more especially from the ANC.
Are you saying, Mama, more than one person using one identity document? I just want to get the clarity.
Yes, that's what they would do. We've got cases here. There are cases that were opened by Rosettenville Clinic that are there at View Clinic. View Police Station.
Okay, Mama. Thank you, Mama. I appreciate it. Stephen, those are some of the insights we're getting from people who have seen what has been happening here for the past 3 days. But coming out of that last conversation I had with the Umama, they're just saying that, well, when it comes to some of the concerns raised, both sides are quite cordial towards each other. There's no violence, but also, Mama, just explaining the fact that people who were denied or were turned away from the clinic yesterday due to water, it had nothing to do whether they are South Africans or non-South Africans. But also, there is an issue of the numbers. Mama is confirming that indeed when it comes to the numbers of people who come through on daily basis, most of those people are people who are non-South Africans, be registered or not, but also, Mama, making very serious allegations which need to be tested as well, that there are those foreign nationals who go to the clinic, carrying, identity documents that do not belong to them, where you'll find that more than 3 people come to the clinic using one identity document. So that's something that we cannot confirm, just narrating what the lady just explained. So that's where things are at, Stephen, right now. We'll try to walk to the other side of this community just to see and check if maybe we can manage to speak to the other group which has been protesting or denying, allegedly, these foreign nationals access to the healthcare facility. We did see them in the morning, but the time we were setting up, they were nowhere to be seen, but we'll try to see if we can track them down and then get their side of the story. And what is it that they understand to be the right foreign nationals have when it comes to having that right to access a public health facility, whether they are documented or not, because it is there in the Constitution, and the South African Human Rights Commission has explained and emphasized that indeed, nurses can't deny anyone that right. So that's the conversations we're hoping to have with the other side once we get hold of them.